Aspiration. You need
Very
to
good.
consider the
We need to prevent aspiration. What is aspiration?
To block the airway of the...
Huh?
Yung sa paghinga niya, ma'am, hindi siya mahirapan.
What is aspiration? Inhalation of any fluids or food, okay, inside the lungs. Instead, the water and food will come into your GIT or gastrointestinal tract. It will go to your lungs, and it will cause you pneumonia. Okay, it's called aspiration pneumonia. The patient will have difficulty breathing. Okay, so that is aspiration. Okay. Now, to prevent aspiration, what is the best position for the patient?
Side.
Lateral position. Okay. What else are we going to keep on the bedside before doing the procedure?
The towel and the basin.
Huh?
A towel and a basin.
What else? Very important machine.
Suction.
Suction machine. Okay. What is suction machine? Where's my suction machine? Okay. This is my suction machine. Okay, this is portable one. But if you are in the hospital, it is in wall mounted. Okay, but this is portable one so you can see. So this is suction machine. Suction machine is very important if you are doing oral care for patients who are unconscious, comatose, etc., etc. Why? Because it will suction the excess fluids. Okay. So we'll keep it here. We'll open the, sorry, it's open na pala. We'll open it, okay. Then we'll regulate it, usually 80 to 20 mmHg. But this one, it's different readings. But usually 80 to 120 mmHg we will put. And then, this one, it is a suction catheter only allowed for the mouth. You cannot put it here, okay? Why? Because it's big. Okay, it's with a big diameter. So it's only allowed, nalimutan ko yung tawag dito eh. It's only allowed to the patient's mouth. Okay? So just keep it open. Okay, then we will use it later. Okay. How we are doing the flushing of it. So if we open it, you pour the normal saline here. Okay, normal saline. Then, it will flush. It will flush, go here. Okay, so that is suction. Okay. 80 to 120, between 80 to 120. Okay, now, let's go. We'll transfer the patient onto the lateral position facing me. So before transferring the turning the patient, we should put the patient there, right? The opposite side. Okay. Ganun na lang natin. Okay. Now, you notice that our patient is with IV. You notice that your patient is with contraptions. Contraptions means with tubes. So if you know this patient is with Foley's catheter or indwelling catheter, and the patient is with IV. So anytime that your patient is turning, make sure that the tubes is also on the same side. Where is the patient turning? Okay. For example, I'm turning the patient on facing on me. So all the tubes will be on this side as well. Okay. Understood?
Yes, ma'am.
Okay. So, this one no problem because it's already here. This one, it should be here. Okay, you get a IV stand. You put it here and then you transfer the IV here. Understood?
Yes.
Okay. Then,
Mas nangawit pa ako dyan sa braso.
Galaw, video natin to.
okay. IV stand ka muna ba?
IV stand ka.
IV stand ka muna. Okay? On.
Ang liit eh.
3. Okay.
Then pillow.
Ang technique to make your patient lateral. Ganyan niyo yung ba? We will.
There.
Okay. We will put the pillow on this side only. Okay. Okay. Then we will put, where's my conti? Conti incontinent pad. Where I put incontinent? Ayan. Ay, hindi. Sa, ano yan? Sa diaper. Incontinent.
Kay Francia naman ako nakagamit.
Okay. So, we will put the incontinent pad here. Okay, you can put also towel. It's okay. But I will put incontinent pad here. Then I put towel here. And I will put my basin here. Make sure that the patient head is on this position so it will drain all the secretions. Okay? Then, so now I need, actually you can use this, but most of the time in the hospital, if you have an unconscious patient, we are using the so-called two-teeth. Okay? Why? Two-teeth is soft. Okay, soft to your oral cavity, and it will not cause irritation and bleeding. Imagine, most of the patients with this one, they have irritated skin, okay, and sensitive skin. So, better to use two teeth, okay? So, you need two teeth, you need paste.
Ang tinataas ko yung dugo ko yan.
May dugo
Yung dugo yan mo pag binababa.
Practice. Practice. We're going to be an assistant nurse.
Tinotoo talaga. Okay, you need this one.
Bag.
Joke lang naman.
Sir David, don't get mad.
Share.
Why do you need this?
To open the
Open the
mouth.
And also to assess the what reflex.
Gag reflex.
Good. Okay, now we already have all the items. Correct? Syringe. Okay, so now we have all the items here. You pour it with water. Okay, we need the syringe. Okay, so what we are going to do, guys, please watch it carefully. What if your patient is with stiff mouth and always biting? What you will do? What you're going to put? No. Oral airway. Okay? If you saw the video that I transferred to you, okay, there is oral airway you can put here to make the mouth open. Okay, you will just put on the side. Okay? Then, this one, how you are going to open the mouth? What you will use? Your thumb. Okay. So your thumb, okay, lower the lower jaw, okay, the lower jaw, okay, pull down the lower jaw like this. Then you can assess the mouth of the patient for any sore, for any infection, okay, for any wound, okay. You can assess also if your patient is with already gag reflex, okay, if ever. Okay, why we are assessing the gag reflex if ever we are using it? Why? Do you know that gag reflex is normal to us, normal person, okay? Normal. Is it normal for us to have gag reflex? If you put your finger on the back of your tongue, you will vomit, correct? Yes. That is called gag reflex. For this patient who are comatose, unconscious, they don't have any gag reflex. Or they have weak gag reflex. Why? Because maybe their brain is affected. Okay? So, if we are assessing it, okay, the gag reflex, and slowly and every day you see improvement, sometimes the patient might vomit. So, there is an improvement to the patient. The patient is having gag reflex. It means that the patient is returning or improving. Okay, improving. Because he's having gag reflex. So it's a good sign. Okay, so assessment is a very good tool. Okay, then you can inform that, you know, nurse, when I'm doing the oral care, when I assess the gag reflex, the patient have gag reflex. Like that. Okay, now, so we already opened it, guys. Okay, so what we are going to do is we will put the toothpaste on the two teeth. Okay, then Oh, there is an excess secretions. There is an excess saliva. So what I'm going to do is to suction it first. Okay, there. You'll see it when you're going to dentist, no?
Yes.
Okay, so this is this one. Okay, then same technique. Okay, using the two teeth, guys. Moisten it. So same technique. So from crown to gum line.
Same like the toothbrush mo.
Same lang. Taas, baba. Okay, then inner to outer. Inner to outer.
Conscious pero dilat yung face.
And then, biting surfaces. Biting.
Weak din yung blinking reflex ng, ng face.
Biting surfaces. And then last is the tongue. Okay, you will notice pag unconscious ang patient, nagko-coat na yung tongue yan. Kulay puti, okay, ganyan. Ibig sabihin nagkaka-fungal infection na yan or candidiasis. Kaya dapat ina-assess niyo yan mabuti para magbibigay ng, I forgot that, Nystatin gargle. Nystatin gargle ilalagay dyan to prevent, to remove the candidiasis or the fungal infection. So after,
Paano po yung proper na paggamit ng anti-statin?
ng
Yung Nystatin.
Nystatin?
Pang patak or hinahalo sa water?
ano ba yung Nystatin mo? Swish and swallow? Pag nakalagay swish and swallow,
Parang siya, swallow ata. Kasi sa
pag ang patient mo conscious, so gagawin mo, ipapaano mo siya, ipapagargle mo sa patient, then pwede niyang iswallow. Pero pag ganito ang patient mo, ilalagay mo siya, if your patient is unconscious, then you will put the Nystatin on the, on the, you can put here, okay, you can put here, and then you can put on the mouth. Okay. Kasi hindi naman nila pwedeng lunukin, ma-aspirate sila. Depende, may dalawa kasing Nystatin gargle. Yung pwedeng, you can swallow or Nystatin na you cannot swallow.
That's the form I did not check.
Mm.
Because when I do that one, the patient, the saturation goes low. So it means that nag-low yung saturation niya. Nagiging 82.
Hmm?
Tapos sabi ko, pwede naman.
But patient is conscious.
Yeah.
Hindi ko pa na-experience.
Yeah. Siya. Sa bagay yung problem naman nun low saturation talaga siya. Always gano'n.
Hindi ko lang na-experience. Anyways, so yun yung Nystatin. Nystatin is being applied for those coated mouth, whites. Okay, you will see also sore. It means that the patient, that one is you will develop that if you are not doing a good oral care to your patient. Then the patient is not rinsing the mouth properly or etc. etc. That's why you are putting the Nystatin. Okay, Nystatin. It's very good. Actually, it's very good. What else? So now, we already brushed the teeth. Okay, what we are going to do is we need to rinse it. Okay, so how we will rinse it is we will aspirate water. Okay, aspirate water. We cannot do like this. Oh, inom ka na. Okay, we cannot do that. What we're going to do is we aspirate water and we should flush it. Okay? Mainit, ano? Okay. Okay, make sure. Okay? Then you can also put mouthwash, okay, para fresh breath si patient. The same way what we did before. And rinse again. Okay, we don't need the floss, okay, because your patient is not eating meat or anything, hard food, okay, so you don't need that. Okay, don't forget to suction it. Suction, open. Okay. Now, suctioning is done. Okay. So we already finished this. Then last is pat dry. And last is we will put the lip balm.
So my question for this, how do you call this?
Two teeth.
Two teeth. I mean, how many would you have on the procedure? Or you're gonna use like one
Two.
throughout?
Two.
Two for unconscious one.
Brush.
This one is for brushing.
Yeah, the other
Okay,
one is
then
brush.
usually it's two. I have a set. I think I
So
actually
for a
three or
patient,
two.
or if you would use for the toothpaste one,
Mm.
then cleaning would be another one. Or I mean, after
You mean the
after you put
putting this?
toothpaste, you have to discard it.
Yes.
Okay.
It's disposable. You will get, if you're going to the hospital or any facility, you will just get one set of it. Then you use to the patient and throw.
Okay.
That's it. Okay? You know, the good thing for this is you can use it for suctioning also. How you will do it, you will connect this to the suction and it's automatically suctioning the water. You will put it here and then automatically when you're doing your thing, okay, it's suctioning also water. Okay. This is good thing for this
brand.
brand. Okay, so you put this in kalas. Okay, then remove this. Remove the things that you use. Throw and dispose. Okay, done. Napat-try na natin. Okay, then turn the patient. Oh, doon ka na, ano?
ID.
IV.
ID man. We'll
Pang
use
ano
that
eh.
man. ID man. ID man.
Okay. Question.